One of the critical factors to rebuild trust in science is to acknowledge where errors were made. One of the biggest errors, from a scientific point of view, was what happened in the military. I have to be cautious with what I say because I'm trying not to be too critical here. So, in the description, there is a link where I have done a far more open ended discussion about what I'm mentioning here. So, if you want to learn more about that, please make sure you click on the link in the description. Essentially, I focused on one particular individual, and the lesson we're learning from this pandemic is the importance of people standing up, trying to make a difference, trying to do what is right. And I'd mentioned an affidavit here that was done all the way from 2021, which we talk about in the presentation, but looking at a number of points as to why this individual took a whistleblowing position to challenge the mandates at the time. Additionally, this is relevant because of what has happened within the past few days. Just on the 27th of January, President Trump has reinstated service members who were discharged under the COVID vaccine mandate. And so that's a recognition of a failure with regards to the science. One of the important things that have to be done now is that there first needs to be an acknowledgement. And I think that it's that currently some in the scientific community, maybe it's ego, maybe it's fear of litigation, but they don't seem to want to acknowledge where mistakes were made. They want to pretend as if there were no mistakes and everything that happened was just as they expected, or if it happened, it was completely unanticipated. I think that when we looked at the data in 2020, we knew who was high risk. We knew not necessarily they didn't know why they were high risk. I did because I was looking at autoimmunity and I was looking at ACE2, and the principles fit perfectly with regards to the risk factors and the cytokine storm. But it's all the more reason to be cautious. If you don't fully understand the disease, why would you risk your servicemen? A critical part of your defense for your nation. They were exceptionally low risk. And one of the papers that I showed, I'll show you this here. I think I can say this without getting into too much trouble here. So make sure you go and look at the full presentation at the link below. But in this paper here, looking at the disparity in outcomes between the military and civilian populations. This was done in 2023. This was very interesting. They took a structured approach to look at the risk factors for expected health outcomes for the active duty military populations versus a civilian population of the same size. And the outcomes that they found were remarkably surprising. And you can see here, this is in the discussion of the paper, the predicted number of severe cases that's requiring treatment in ICU was significantly smaller. Specifically, in terms of the total ICU days, they estimated that to be 1,076 in total days, not patients, for the military population. And this was about 40,000 people, they thought, but 25,324 for the civilian population, almost 25 times lower than the civilian population. So these were young, healthy, fit young people, and the science that was applied clearly must have presumed that transmission would have been blocked, because otherwise it really, really made no sense. And even that needs to be acknowledged and stated openly that maybe there was a misreading of the science, but it doesn't seem as though we are getting that kind of openness and clarity. And the hope would be that depending on what happens in the next few days with regards to the current US government, who tend to lead the way for the rest of the world, maybe there's a chance that these issues can be addressed. For me, What I'm focused on is the fact that many of these personnel may now be at risk for what I call the COVID storm. Immune primed, recurring infection, which is likely to be happening as well within the military facilities. What are the outcomes? And one of the things that did come out in terms of the affidavit and the statement, there was another statement that was done in 2024 that was by a number of service people, and they were literally calling for the resignation of some of the leaderships who they thought broke the law, trampled on constitutional rights. You can see that in the presentation. And they highlighted the fact that some people were harmed and that some people even died. So these are significant. And what is required is honesty, acknowledgement of errors, so that we can get back to the fundamentals of science. There is going to be a long, hard road to rebuild public trust, and everybody needs to participate. And what we are taught in medicine is the duty of candor, where we have to tell you when there's a mistake, when there is a problem. We have to tell you. This clearly does not exist in the political and the financial arena, which is a problem. And so therefore, if we can't get at easily, it will have to, it seems, come by force in some way, shape, or form. But as I said, please take a look at the link in the description, watch the video, join my Substack. I'm able to be a little bit more frank when I do my videos there. Hope that you enjoy it and find value in the times ahead. Have a good evening. Look forward to sharing more information with you in the near future.